We know, now there's more evidence, that there are chronic cycles of hunger each month in many family households, many adult and family households. Peter and I were in Bracebridge speaking on poverty, and we learned something we hadn't known before, that every year public health units survey which households can or cannot afford the cost of the nutritious food basket. And these reports are submitted to the province every year. And we had learned that these reports were going in since the late 90s. They've never been published. And each year, these reports indicate that there are certain sets of households where people lack the ability to purchase sufficient food. And when we've done meetings and speak to people with lived experience, the story is heard over and over again about how money runs out for food in the third or fourth week. And that we have what we call chronic cycles of hunger. Chronic in the sense that it's not every week, but it emerges over that period of time. That's what it means, by the way, to live in poverty. That money runs out for certain key necessities. So when we spoke to people with lived experience, and we heard these stories, we said, well, what would help immediately? And so people said, well, it's generally 2 weeks where we have these difficulties, and if we had $50 a week for 2 weeks, that could go a long way in help. And so that's where the $100 came. It came from people telling us what their experience was and saying, this would be helpful. And this campaign for the healthy food supplement has grown. It's led to something called Do the Math, where the Social Planning Network of Ontario, with a local agency called The Stop, have challenged people to determine how they could live on current allocations. It's no surprise that people cannot live, and people who've taken this challenge have come from all backgrounds. The number they come up with, interestingly enough, of how short they are, about they need about $1,300–$1,400 a month as single people to be able to meet the expenses. It just happens to be similar to the number that exists in poverty measures. So if you want a good example of these poverty measures are not abstractions, when people have taken them and they've asked, well, what would be the number you would need to make it through the month? They come up with, we need $1,300, $1,400, $1,450 a month. That's the ballpark. The poverty indicators indicate somewhere between $16,000 and $18,000 a year. So this is a crucial campaign, and I will talk about why it's important, because it's broaching the taboo. And the taboo on poverty work is advocating for people living on social assistance. That is the great taboo. Because there is a whole set of contentions, a whole set of statements made that serve to degrade the integrity of people on social assistance and make them unworthy for further support. And we will talk about that briefly this morning. So the Healthy Food Supplement does two things. One, there are people across Ontario now standing with people on social assistance for the first time. We've had a campaign like this in 20 years or more, where people say, you don't have enough money for basic food. And the other thing that's interesting about the Healthy Food Supplement is that the contention is shifting. It used to be people who are on social assistance are hungry, so anything we give them will alleviate hunger. And what we give them is less important, that they have something. And as I heard in one discussion from someone, we go to a food bank and I'm single, they give me pasta, but I don't get the sauce because the sauce is saved for families with children. I ask for tuna, they give me sardines, and they say, well, what's the difference? It's fish, isn't it? Right? Try going to try going to any place and ordering tuna and having them bring you sardines and saying, well, it's the same thing as your dignity would be affronted. Well, what the healthy food supplement is saying is that people have an entitlement, not just to suppress hunger, but good food for their health. And that health begins with good food. And we have medical officers of health, thank God, across the province who are saying that publicly, because this campaign has received enormous support from medical officers of health in many communities and public health boards, because the issue is now coming to emerge that good food is a human right, and that good food is one of the foundations of good health. And it's not enough just to say we'll suppress the hunger, starch up or whatever up you can. So this is an important campaign, and we think that it's crucial that we continue it and that the government demonstrate that they understand what poverty means by supporting it. Because a single person, as many of you will know, on social assistance is supposed to live on 500, I forget what the number is, 85, 91, it's one of those numbers. Okay.